Hi, everyone. Just wanted to introduce myself briefly. My name is Alex Wiseman, and I am a health promoter with the Windsor Essex Community Health Center. So tonight will be facilitated by myself and my colleague, Jody Pierce. So we'll be alternating in the form of moderators. But I did want to get started because we do have a jam-packed night ahead of us for the next 2 hours. And we do want to thank you in advance for spending your evening with us. So just a brief overview about WCHC. We're a community health center serving members of Windsor, Essex County, and we offer a wide variety of free services that are inclusive and confidential. And without going into great detail about that, we do urge you to check us out at wechc.org after tonight's webinar. So welcome to the 7th annual Not My Kid event. And I should actually call it semi-annual because we've been hosting about 2 a year for the last few years. So this initiative began in 2017, and this is actually our first virtual forum. So we do thank you in advance for your patience with that. If you know someone who, would have liked to attend tonight, but wasn't able to, or, maybe couldn't reserve a ticket, because we did have 100 tickets available and we've reserved all of them as of yesterday morning. So we do know that this is an issue in our community, and we're thankful to see people coming together for that purpose. So if you have someone in mind who maybe would have liked to attend and couldn't, please be sure to share this information with them, that we are going to be posting this on our YouTube channel in the coming days. So we're recording the webinar, and we'll be sure to share this important information with everyone. It's not something we need to necessarily keep close to just ourselves. We do want to share this message with as many folks as we can. So stay tuned to our social media outlets as well. Please note that all of your microphones and cameras will be muted, so you may simply enjoy our time together tonight. But we have enabled the question and answer feature on Zoom. So you should see at the bottom of your screen that there's a feature there to ask questions, and those will come directly to Jody and myself. And from there, we'll mitigate the questions that should be answered by ourselves or should be answered by perhaps a social worker, addiction support worker, Windsor Police, or someone with lived experience. And we're going to do our best to get to all of those questions, provide you with as many answers as possible, and make sure you leave tonight with as much information as you're looking for. And we do appreciate your participation in advance with that. But most importantly, we want to thank you for taking time to discuss a topic that is very important to not only us, but to our community as well. So at this time, I would like to introduce local social worker Maria Derubis to get things started with a poem and an overview of the relationship between mental health and addiction.
The poem I'm going to share really details what it's like to be affected by addiction. As a mom directly affected by my son's addiction, I can truly state that the words in this poem are an accurate description of the reality that we have lived over the last several years. Although he is on the road to recovery, I must say many others have not been able to survive this devastating issue in our community. So without further delay, I'm going to go ahead and read this poem. It's entitled A Poem on Drugs. Hello, my name is Drugs. I destroy homes. I tear families apart. I take your children, and that's just the start. I'm more costly than diamonds, more costly than gold. The sorrow I bring is a sight to behold. And if you need me, remember I'm easily found. I live all around you, in schools and in towns. I live with the rich, I live with the poor. I live down the street and maybe just next door. My power is awesome. Try me and you'll see, but if you do, you will never break free. Just try me once and I might let you go, but try me twice and I will own your soul. When I possess you, you'll steal and you'll lie. You do what you have to just to get high. The crimes you'll commit for my narcotic charms will be worth the pleasure you'll feel in your arms. You'll lie to your mother and you'll steal from your dad. When you see their tears, you should feel sad. But you'll forget your morals and how you were raised. I'll be your conscience. I'll teach you my ways. I take from parents and parents from kids. I turn people from God and separate friends. I'll take everything from you, your looks and your pride. I'll be with you always, right by your side. You'll give up everything, your family, your home, your friends, your money, and you'll be all alone. I'll take and take till you have nothing more to give. When I'm finished with you, you'll be lucky to live. If you try me, be warned, this is no game. If given the chance, I'll drive you insane. I'll ravish your body, I'll control your mind. I'll own you completely, your soul will be mine. The nightmares I'll give you while lying in bed, the voices you'll hear from inside your head, the sweats, the shakes, the visions you'll see. I want you to know these are all gifts from me, but then it's too late, and you'll know in your heart that you are mine and we shall never part. You'll regret that you tried me, they always do, but you came to me, remember, not I to you. You knew this would happen. Many times you were told, but you challenged my power and chose to be bold. You could have said no and just walked away. If you could live that day over, now what would you say? I'll be your master and you'll be my slave. I'll even go with you when you go to your grave. Now that you have met me, what will you do? Will you try me or not? It's all up to you. I can bring you more misery than words can tell. Take my hand and I'll take you straight to hell. And I must say, every time I read this poem, it truly saddens me to know the struggles that our young people have with mental health and addictions. Thank you for listening. So we'll start by defining mental health. And mental health includes emotional well-being, psychological well-being, and our social well-being. Mental health affects how we think, how we feel, and how we act. It helps us determine how we handle stress, relate to others, and make choices. Mental health is the ability to navigate successfully the complexities of life, to develop fulfilling relationships, adapting to change, and the ability to utilize healthy coping mechanisms. The truth is that we all have mental health. Mental health is important in all stages of life, beginning from childhood right through to adulthood. Mental health can change over time, and the mental health problems can be very common amongst many of us. Stats Canada states that 70% of young people ages between 15 to 24 are likely to experience mental illness and or substance use disorders than any other age group. Now, sometimes we may confuse mental illness with mental health. What is the difference? Mental health is not the same as mental illness. Poor mental health can lead to mental and physical illnesses. A brief definition of mental health is that we are resilient. We can handle life's changes and stresses. We can have meaningful relationships and make sound decisions. It's really a general state of well-being and state of mind. Mental illness sometimes disrupts your mental state and interrupts how you feel, think, and communicate, and also behave with others. Mental illness can also be defined as a health condition that changes a person's thinking. It may change your feelings, and it may also change your behaviors. Sometimes it changes all three. Sometimes it changes just one or the other. When we look at the causes of mental health, there's really not just one cause that we can say causes mental illness. It's a multitude of various issues that happen in a person's life. However, in this situation, we'll break it down to three areas: biological, social, and psychological. Mental illness is very common among youth and adolescents. And when we look at stats, it affects 1 in every 5 young people at any given time. Biological factors are anything physical that causes an adverse effect on a person's mental health. Human behavior is triggered by brain activity, such as brain injury, infections, prenatal damage, substance abuse, our physical health. Environmental factors or social factors. These are most common in adolescence as stress. A child's family circumstances, what's happening at school, are they being bullied? Is the teacher being too difficult with them? Is there a lot of peer pressure? Has there been trauma in their life? And then the psychological cause, which is really, when we look at that, it's usually abuse to some form, trauma, an early loss of a parent, neglect, and an inability to relate to others. I just have a few stats here. Out of 49 cities, Windsor Essex County is listed as having the 7th highest number of opioid users, and the overdose rate is 50% higher in Windsor Essex County than any other provincial rate. I was able to find stats from 2019, and we had 249 opioid-related emergency visits. These visits have doubled since 2016. In 2016, there was 108 visits to ER compared to 249 in 2019. The Chief Coroner of Ontario has reported that in 2019, there were 47 opioid overdose deaths. 64.9% of overdoses usually occur in private residences. And that's why it's so important that if you are able to pick up a naloxone kit, they are available at pharmacies and they're free of charge. And it's really important to have this on hand. You never know when it's needed. In 2019, there was over 5,000 naloxone kits distributed among Windsor and Essex County. What are the risk factors for drug abuse? As you can see from the chart, undiagnosed or untreated mental illness, oftentimes youth will begin experimenting with drugs to deal with anxiety, depression, ADHD. There could be some rejection from their peers, poor academic performance. They may be struggling with seeing their own parents struggling with their own addiction. They may have friends who are experimenting with drugs or alcohol. There could be child abuse or neglect. The more risks a child experiences, the more likely they are to abuse drugs. Some risk factors may be more powerful than others and appear at different stages of development. However, as much as there are risk factors for drug abuse, there are many protective factors. And it would be really important if we can somehow balance the two within families. And some of those protective factors are things like a parent's involvement in their child's life. Ask them what they're doing. Be curious about the friends they're seeing. What's happening at school, what's happening at their job if they're working. How are their friends doing? Where are they hanging out? Also, setting clear limits and being consistent with enforcement of discipline. Too often these days, I'm hearing that parents are reluctant to be consistent and to have clear limits with their children because they don't want them to upset them. We are not to be their friend. We are their parent, and we should be able to have clear guidelines with our children so that we can be there every step of the way. Now, that does not mean that we can prevent drug abuse, but certainly we can have those protective factors in play. I'd just like to briefly go through some of the symptoms of addiction. In terms of behavioral changes, we can see a drop in school attendance if they're missing a lot of school. Their grades may drop. They may be maybe spending time alone. They may be engaging in secretive behaviors. They're changing their appetite, their sleeping patterns, sudden mood swings, irritability, anger, lack of motivation, and just an unexplained change in attitude or behavior. The physical changes that you may notice are bloodshot eyes, abnormally sized pupils, a sudden weight loss or gain, a deterioration of physical appearance, so they may not be taking care of themselves the way they used to, unusual smells on their breath or their body, their clothing. Sometimes youth will display tremors or slurred speech. In terms of the social changes, we see sudden change in their friends, hobbies, hangouts. They may stop participating in the extracurricular activities. They may start experiencing legal problems related to substance abuse, an unexplained need for money or financial problems. If a youth holds a job, they may be constantly out of money. We need to ask, where's your money going? Is there something that I can do? Is something happening in your life that I need to be aware of? And oftentimes they will continue to use substances even though they see how much problems it causes in their life with their parents, friends, school, and so forth. It's really important that we encourage our youth to reach out to anyone that's willing to listen, whether it's a social worker, a counselor, school guidance, a teacher, a friend, a coach, a family member, really anyone that can offer support. We want to encourage our youth to go speak to them, pave the road to getting some help. And sometimes it's okay to not be okay. You're not alone. Everyone has problems. You are not a burden and you are not weak. Allowing yourself not to feel okay involves accepting all your feelings, thoughts, or sensations and sitting with them until they pass. And it's really important that we express that to our youth to help them understand that nothing is permanent. That yes, you may have these really uncomfortable feelings, but there's nothing that we can't find a solution to. And if we ignore these emotions, if we ignore these issues, they just start to build and build and they become overwhelming for the youth. And we need to encourage them that it's okay to have these feelings. It's not okay to use drugs. But if you are using drugs and you need some support, that we are here to offer that. And that is just a very quick synopsis of mental health and addictions. I'm sure that we could probably present much longer than this, but just to be courteous to the other presenters, this was just a very brief introduction.
Hi, thanks so much, Maria, for sharing that valuable information with us. It's so important for us to know the difference between and the relationship between addiction and mental health. So we really appreciate you sharing your expertise with us. So yeah, if anyone has any questions, you can certainly post them to the Q&A at the bottom of your screen, and we will navigate through who needs to have the question or see who we can answer the questions the best. So I'd like to also invite and welcome Margaret, our first lived experience guest speaker. So Margaret came to us through a connection, Maria, and we thank you for connecting us with Margaret. She has graciously agreed to share her story with us this evening. So welcome, Margaret.
Hi, how are you tonight?
Good, how are you doing?
Good, good, good.
Good.
Yeah, this is very interesting. I am a lived experience of drug addiction, and it's about my son, who was an addict for years. So I'm going to start by saying, dear worried parents and everyone involved, let me start by saying I never wanted to be here. I know well the denial, confusion, and guilt, and how scared you must be. It's like a bad dream, and it takes your breath away. I was that way for years, and I mean years, but I can say there's nothing to hide, and it is what it is. There's nothing to be ashamed of, and talking about it is probably the best thing that you can do. Being an addict is not necessarily someone living homeless on the street, pushing a buggy, or from which end of the city you come from. Could be someone from all walks of lives, rich, poor, whatever. I wondered for years why my son couldn't seem to get over his struggles with drugs, depression, and anxiety, and you name it. Sent him to rehab, detox, counseling many times, only to see him have glimmers of getting better and then see him descend further into self-destruction. Everyone's story is different in some way, but the pattern remains the same: frustration, anger, hopelessness, and guilt. So you keep trying one thing after another, hoping that this will be the answer. Well, I must say, my son is now 32 years old, alive and well, and there is hope. He has turned his life around after many years of struggling with drug addiction, opiate addiction, I should say, fentanyl, all of it, injecting, whatever, you name it. Many years of struggling with his drug addiction. He was an elite hockey player for many years. He played in the OHL. He was drafted to the Dallas Stars at the age of 18. What can I say? Now, when I look back and think about it, I see the mental health issues he had in situations to find out years later that he was bipolar. And that could be part of the drug addiction also, is probably from some of the drugs, because it came out more later in years. His addiction with opiates started after a knee injury from hockey when he played for the University of Western in his early 20s. He had knee surgery and was given oxys for pain. And I remember when he left the hospital, I was there, and they gave him a bottle of oxys of 100. And I was like, that's a lot of pills. Anyway, he lived there, but I lived in Windsor at the time. So I can say it was at least a year before we even knew he had an addiction to opiates. That's when everything went downhill. Robbing Peter to pay Paul so that he could get those drugs, pawning things, stealing, you name it, owing money. He was chasing his own tail for years, and it was very sad to watch. I felt so helpless, and so did my husband. Through that whole predicament, there's just so much to talk about and not enough time. But he did OD halfway through his addiction part of his life. He OD'd one night on fentanyl. He had stopped breathing, and thank God my husband was able to revive him by kneeing him in the chest as hard as he could so that he could shock his heart. And the police officer that came that night said that they couldn't believe that if he hadn't have done that, he wouldn't be here today. That still did not stop him from taking drugs. The only thing I can say is that they have to be ready to quit. They have to be ready. And it takes years sometimes for them to be ready to quit. They just have to be done with it or whatever. And it's the craving. They crave and they crave. We spent all kinds of money on rehab counseling, and nothing was working, nothing. I mean, you're looking for help from someone. You want someone to help you in some way or form. And if they don't want the help, there's nothing that anyone can do. And that's the biggest problem. I must say one thing though, never ever give up on them. I know parents that when I'm driving down the street sometimes, I see a kid pushing a grocery buggy with stuff in it. I know he's homeless. He's probably gone so far beyond what has happened in his life, and he has, taken advantage of everyone and everything, and his parents have given up on him and everything. And it's very sad because they need help, and they're not going to get it by being out on the street like that. They're just not going to get it out there. And I know that, enough is enough and all that stuff. I've been there. I've done it. I did it for 12 years. And I mean, I put him out on the street a few times also and stuff, but my husband and I just never gave up on him, just never gave up on it. And I'm glad we didn't, because he wouldn't be here today, I think, if we did. Yes, there's only so much someone can do to help. It's up to the addict themselves when they're ready, and it will happen. I've heard a lot of stories out there, and some I've read about, and they all hit home. And it's a very emotional thing, drug addiction. It's a very emotional thing. Some days you're okay, some days you're not. You know, you get to the point in your life where you can't take it anymore. Um, like I have no more patience left for anything because of dealing with all of this over all of these years. So the patience part of it is gone. You know, you can only have patience for so long. It's the unknown that scares us the most. Thinking, are they going to OD or even die from this? We don't know. You will still never stop worrying until they get better. It takes a lot of patience, a lot of patience, a lot of hard work, knowing there could be a light at the end of the tunnel. I can only say one thing. My heart goes out to each and every person out there that is dealing with drug addiction, because it's not, the drug addict doesn't know what's going on because the drug addict's on drugs. It's the parents, it's the sisters and brothers, it's the family, it's the grandparents, it's the friends, it's the extended family. It affects all of them, everyone out there. It affects them all. And it's just, it's awful. And it's getting worse in the city. And you read about it all the time in the newspaper. And I don't know, this epidemic is so bad. It's just, something has to be done. And I mean, I know a lot of people say just give up on them. You can't give up because there is hope. It's a long, hard road to recovery. And there's so much about relapse and all this stuff. And it's true. My son relapsed, I don't know how many times. And that's fine. It's not here nor there. But, you know, and another thing is that, you know, when he was diagnosed with bipolar, it's taking the medication. They stop taking it. They think they don't need it anymore. So then they go, like, he's had manias. He's been hospitalized for that. So he's now on a steady medication for bipolar, and he takes it regularly, and he's okay. You know, I mean, I can still see the mental illness part in him, where, like, with being bipolar, you know, the depression and all that stuff. But that will probably be something he'll always have for the rest of his life, you know. But one thing you have to remember, your child is alive today, and there is hope. My son is a good example. I want to thank you for letting me say what I needed to say tonight, and inviting me. I enjoyed this very much. It was something that I needed to do. Thanks again.
Thank you so much, Margaret, for sharing your personal story. Also, your message of hope is really important. And I like how you touched also on, you know, stigma, because it's not always the, you know, homeless person pushing the buggy down the street. It affects many of us in many different ways and from all generations and socioeconomic statuses. So we really appreciate you touching on that point also. So thank you. So next, I would like to introduce our second guest speaker for the evening, Chad. So he's going to share his personal story from a different perspective, and he's got a lot of really great information to share with us this evening as well. So welcome, Chad.
I was listening to the lady before us speak, and you know, it's true. I came from a middle-class family. Where I grew up, it was like the culture. There was 8 bars within 3-4 blocks. You know, it was okay to do drugs and party, and no one frowned on you for that. As I grew older, when I was 13, I had my first drink, and a little short time after that, I tried LSD. So I drank and I did LSD, but I was only on weekends. I played a lot of sports. You know, I grew up as a normal kid. I was 17. I tried cocaine. I say a lot. I'm sorry. So and I didn't like it. I really didn't. 21. I was married to my wife. I started at Ford's when I was 21. 22, I tried cocaine again, which turned into a 23-year love affair. You know, and it does, it affects everybody. And as a drug abuser, I didn't realize the effect it had on my children and it had on my wife. It just, it is shame. It's shame and guilt that kept me going. Geez, my mind is all over the map right now. Just, you know, I come home one day and I was on a 3-day bender. Did I just mess that up? Mute.
No, you're good. We can still see
sorry.
you and hear you. Yeah, you're hanging
Sorry,
in. You're
Jody,
doing great.
I'm a little nervous. I'm not good at this yet.
No, you're doing awesome, Chad. Thank you.
So I came home, I jumped in the shower, and at this time in my life, I was dealing drugs because I couldn't afford to do the drugs. So I had to sell drugs so I could support my own habit. So I came home, and this was where I hit my bottom, but it still didn't stop me. I took a shower and I went to leave, and I couldn't find my car keys. My wife had took my keys to hide them so I wouldn't kill somebody because, like I said, I was up for 3 days and I was drinking and I was drugging, and I hit my wife. And I hit my wife like she was a 6'5" man, and that fueled my using and my addiction for another 12 years. You know, all I had to do was sit down, and I get emotional talking about it because I love that. Well, I love my wife. I love my wife more than I love the air I breathe. I just, you know, I just had to sit down and talk to her, and I never did. I was ashamed. I was embarrassed, and you know, because I always prided myself on not being that guy, but the drugs turned me into that guy. I went through rehab 8 times. 8 times I went to rehab. They asked me what I was using, and I always said I didn't have a drinking problem. I only had a drug problem, and I was too naive, and I was too messed up on drugs and alcohol to realize that they came hand in hand, and they did. They really did. My son, and this was the turning point of my life, was my son. Him and his girlfriend she was giving birth to my grandson. It was March 8th, 2018. I went to the hospital. I was going through withdrawal. I wasn't feeling good, so I left. And I came back 2 hours later, and I was drunk and I was high. My son brought me in to see my grandson, and then he asked me to leave. And as we were walking to the elevator, he said to me, he said, "You know, you taught me one thing as a dad." And I said, "What was that?" And he said, "What not to do." And yeah, that hurt, but I needed to hear it. And then he asked me to go home, and I went home. That still didn't stop me, but it put a seed into my head, and I started thinking. And I used for another 3 months. I OD'd 3 times. My children had to rush me to the hospital. My 2 youngest daughters. So I went to treatment number 9, and I told them the same thing. I told them I didn't have a drinking problem. It was just a drug problem. And I spoke to my wife on the phone, and she said, "How about I just come and get you?" And, you know, I was sitting in my room, and I just started thinking about things that were said to me over the years. And I remember my dad the one day when I went through treatment one time, I was in the bar and shooting pool, but I was drinking 7-Up, and I thought, you know, this is all right. But he came in and he said, "If you sit in a barber's chair long enough, you're going to get a haircut." And you know, I didn't understand what he meant. And because I didn't want to look stupid, I never asked what he meant. But I was sitting in a rehab center in August of 2018, and it dawned on me what he meant. If I keep hanging around the same places and the same people, I'm going to use. And that's the truth. So I've been clean and sober since August 1st, 2018. I changed my lifestyle, and that was the biggest point of getting clean and sober. Was I changed who I hung around with. I changed the places I went to. Today, my wife is my best friend. My kids are my support. My kids are who I spend time with. I wasted a lot of time out on the streets, you know, trying to be a thug. But today I'm about making lasting memories with my wife and my children. And it's true, we do recover. But if anybody needs to talk or ask any questions, go ahead. I'm open. Thanks, Jody.
Thank you so much, Chad, for sharing your story. Your very candid story. I appreciate you being honest and heartfelt with us, and we enjoyed hearing your story. Although it's tough, but you know, you're in recovery, you're in a good place, and we appreciate hearing that you can get there, and that means a lot to so many people. So I thank you for sharing it with all of us.
Thanks.
So now I would like to introduce our next speaker, Lexi. And like everyone else, she didn't hesitate to jump in and join and speak with us tonight. But what's different about Lexi is that I've known her since the day she was born. And it makes me super proud to have you here today and sharing your story with us. And it's a good story. And we're just so happy that you're here. So thank you.
Awesome. Thanks, Aunt Jody. Hello, everybody. My name is Lexi. I'm 24 years old, and the last time I touched a drink or drug was December 16th, 2017. So I'll be 3 years sober in about 3 weeks. When I was asked to speak tonight by my Aunt Jody, I immediately said yes, and then the panic set in a bit afterwards. I've actually never shared my journey of addiction with anyone fully, but my sponsor. However, a week prior to tonight, I came to the conclusion that this really isn't about me. And it doesn't matter if I slip up, as long as I can help at least one person tonight, not feel like what they are experiencing is something that they have to experience alone. And as well to give some parents out there in the audience who have kids who are struggling some hope that it can get better. So I'm going to try and sum up what feels like 100 years into 15 minutes. And I'm going to begin with how my addiction started, then where my addiction took me, and finish with where I am today. So I grew up in Tecumseh. I have two of the most supportive and understanding parents to walk this earth, and a younger brother who is now one of my best friends. My childhood was great. I participated in sports throughout grade school. I was always a straight A student. When asked what I wanted to be when I grew up, my Grammy would get super excited when I'd say a writer. Everything on the outside was sunshine and rainbows. However, on the inside, I never quite felt satisfied with who I was as far back as I can remember. I can look back now and realize that I was just very insecure, and not just in regards to my physical appearance, but socially as well. I had friends. I was by no means a social outcast, but I never truly felt like I belonged. I was uncomfortable with myself as a person. And this is significant because when I had my first sip of alcohol, I felt none of that. I had my first experience with drinking when I was around 12 years old. And when I say experience, I mean total blackout, exorcism style vomiting disaster. It's safe to say me and my girlfriends did not wean slowly into drinking. Alcohol was very accessible at one of my friends' houses, and by the time I was 14, it became an every weekend occurrence. We'd wait for her parents to go to bed, sneak downstairs, steal and water down whatever kind of alcohol we could get our hands on. And regardless of how sick I got during or afterwards, I loved it. You know, we'd go to parties and the cab would show up to drive us to whatever sketchy house party we were going to. And while they'd be getting into the cab, I'd run back upstairs to sneak another 3 or 4 shots because I needed to be inebriated before attending any of those get-togethers. The thought of being sober and meeting new people and socializing completely freaked me out. And being drunk took all of those worries away. So as you can imagine, this didn't lead to anything good. When I was 13, I was assaulted by a boy my age at a party. Looking back after that occurred was when I truly began to feel like a piece of me and a piece of my innocence was lost. I began to spiral in more ways than one. I also developed a severe eating disorder at this time. So throughout high school, My coping mechanism was alcohol and my eating disorder, which you would have never known because at prom, I won the Little Miss Sunshine Award for brightening people's days. Well, inside I was suffering, and I was able to put this mask on every day that I was doing so wonderful and I didn't have a care in the world. But on the inside, it was total chaos. And I also had the nickname of Swamp Mermaid because I passed out in the pond for 6 hours at a party. So it's safe to say that drinking with me was never fun. Like, it was never a fun thing to be around. The running joke within my friend group was a bet on whether Lexi would pass out somewhere, start crying, or fight someone, or perhaps all the above when I drank. And I never drank unless I knew I could get extremely intoxicated. I found casual drinking to be extremely pointless. I could never go out and have a normal night. But regardless, I loved drinking, and I loved the feeling of having the confidence to speak my mind and not care what people thought of me. It was kind of a freedom from the negative and self-defeating noise in my head every day. So grade 12 came around, and my eating disorder really took a hold of me. I was under 100 pounds, and my parents said, you either need to go to therapy and put some weight on, or we're going to have to put you into an inpatient treatment center. So I opted to go to therapy and put the weight on at home. And coincidentally, this occurred right around my 19th birthday. So now I had access to alcohol whenever I wanted. I could drown my sorrows and self-disgust at my weight gain with drinking. So this is when things really got out of control. I was enrolled in pre-health nursing at the college because I wanted to be a nurse, and I dropped out in the middle of my second semester. I was bartending at a local restaurant, which of course is every alcoholic's dream. And I realized that if I just drank throughout my shifts, I thought I was funnier, I made more tips, and the time would fly by. I thought I was operating under the radar, but issues kept coming up with my performance, which I attributed to that, oh, that person doesn't like me, and not, oh, that person obviously realized I'm constantly hammered and doesn't like that. So I'd finish my shift, I'd go home to my parents at 9 p.m. and be absolutely plastered. And in an effort to hide how drunk I was from them, I'd stay up in my bedroom and I'd drink alone. And drinking alone led to a lot of depression, self-harm, and multiple suicide attempts, as well as brushes with the law. These incidents continued to build until my parents, after multiple attempts of trying to get me to stop, said you need to go to rehab or you need to move out. So being 19 and completely dependent on them, I chose to go to treatment. I knew deep down something was wrong. So my first treatment center was the House of Sophrosine, a 35-day trauma addiction focused rehab center. And quite honestly, I went in there like, what the hell? I'm not nearly as messed up as any of these women. I'm 19. I'm obviously not going to never drink again. And I finished the program and drank the day after I got out. So another year ensued of me drinking myself into suicidal binges and becoming so dependent on alcohol that if I didn't drink as soon as I woke up, withdrawal would start. And withdrawal was something that scared me more than any other consequence. I'd steal from anyone so I wouldn't have to go through it. I can only describe it as, you're hot, but you're cold, you're shaking uncontrollably, and you're puking to the point where you can't breathe. And at this time, I also couldn't hold down a job for the life of me. And when I was out of money, I would buy Listerine bottles and drink that instead. Around this time, I also discovered cocaine, which I immediately became hooked on for the sole purpose that it meant I could drink more. Around this time, I was also passing out in Tim Hortons bathrooms, as well as on university campus. I had to be rushed to the ER twice because I was found unresponsive. So almost exactly a year to date, I went back into rehab at Westover this time. My parents paid $5,000 to get me in immediately. And to make a long story short, after Westover, I stayed sober for exactly 3 months. And I relapsed because I thought I could smoke weed and not touch any other drugs or alcohol. Evidently, I could not. My parents were obviously devastated. And, after getting sober Lexi back for just a short period of time. So in September of 2017, my parents finally could not deal with my behavior anymore. My alcohol use was destroying my parents, my brother, my family, my life. I was stealing from them, constantly getting into arguments with them, and I actually got into physical fights with my mother and father if they would try and take any drugs or alcohol that they found in the house. And enough was enough. So by this point, I had burned all bridges with my close friends. So I turned to the people I was using drugs with and asked for a place to stay. This turned out to be one of the worst decisions in my entire life. I was staying at a house where people would go in and out of the house all times of day and night to buy drugs. And I was constantly drunk and high. And I was in and out of consciousness for over a week. And on the 7th day, I woke to being sexually assaulted by 2 men. I called my CMHA worker for help afterwards. She literally picked me up shoeless on the street outside of the drug house and brought me to the hospital, then to detox, and then drove me to the homeless shelter. This would be my 6th visit to detox in 2 years. And I have never felt so alone than when I was in that homeless shelter. Trying to stay sober was almost impossible. People are constantly doing drugs in the bathrooms at all times of night. I found myself wondering, how the hell I had gotten to where I was. But realistically, I knew how. The havoc I had wreaked in just 2 years was just like incomprehensible. My addiction took me down really hard and really quick. And I looked around me and I realized I had turned into exactly who 2 years prior I had turned my nose up at in my first treatment program. I was one of those women who would tell me they wish they'd gotten sober at 19 and could take back all those horrible things that had happened to them. I had finally hit my rock bottom. So while in the homeless shelter, I got in touch with a program called We Fight. And my CMHA worker and my We Fight worker got me back on my feet and helped me get into treatment in January. And I was able to spend Christmas at home with my family, which was a blessing after all I had put them through. I returned to the House of Sophrosine again. I completed my program and I focused on getting an apartment once I got out. I attended meetings almost every day. I got a sponsor and enrolled back into the university. Keeping myself busy really helped, but that's not to say I didn't get cravings constantly for the first 6 months, at least. I'd call my sponsor crying because I'd want to use so badly, or I'd sit in self-pity because I'm 21 and I'm told I can never have a casual drink again. And I remember saying to my counselor at the House of Sophrosine, I said, "What happens when I get married? Like, I can't even drink at my own wedding." And she responded with, "Lexi, you don't even have a boyfriend right now. You need to take it a day at a time." And so I did. And yes, the thought of not being able to drink again really freaked me out. But what freaked me out more was imagining lying in the homeless shelter again and having no one to reach out to because I'd wronged everyone who had tried to help me. My final time in rehab, a speaker came in and spoke to us about her sobriety. And she said to us, "There's a bottom below the bottom you know." And that has stuck with me ever since. I don't want to know what other bottom awaits me if I decide to use again. So that first year, meetings and surrounding myself with sober people is really what got me through. To my surprise, there are a lot of people my age who are sober, and many of those people are now my best friends today. My boyfriend is also 2.5 years sober, and it definitely makes a huge difference for me to have someone who, like myself, can go out and have fun doing things that don't involve drinking. And, to my shock and amazement, you can have fun without drinking. Being around people who drink no longer bothers me. My mom will ask me if it's truly okay if she can have a glass of wine around me, but it really is no longer something that is on my mind. I no longer drive by the LCBO and get knots in my stomach. I can attend get-togethers and family parties and not bat an eye at the vodka bottle on the counter. My life no longer revolves around when I can get drunk or high next, and I am finally comfortable in my own skin. I will be graduating with my degree of psychology at the end of next month at the university, and I'm going on to get my master's in counseling. I have a full-time job, a big Labrador who lives with me at my little apartment, but most importantly, I have the trust of my family back. My parents, my boyfriend and his parents are here today in this call. I have 2 of my aunts in here as well who took me in when I was struggling and have supported me ever since. So it truly can get better and we do recover. By no means was it a walk in the park. I felt awkward being around people sober for honestly like the first year, but it is so worth it. And now I can do things like this. I can be open and honest about my struggles with addiction. So I'm extremely grateful for being able to have the opportunity to speak tonight. And thank you all for taking the time to sit down and listen.
Thank you so much, Lexi, for sharing your story. It was a long journey, that's for sure, but I'm so very proud of you today and everything that you've accomplished. And you're still a beautiful little soul. So thank you again for sharing that with us. And you did a great job.
Thanks.
You're welcome. Okay, so and thank you also, Margaret and Chad, and Misty too for sharing in terms of her role. We've got a really wide variety of things that we're discussing tonight because we're trying to just put the whole picture together for everybody, no matter where they might be on the spectrum of either using a recovery or a mom or a loved one. So we're really trying to get a lot of information crammed into a 2-hour period. So I think next, I'd like to introduce Claire. Right, is Claire next?
Yes.
Yes, okay, sorry. Claire is one of our coworkers. She's with the STEPS program at the Windsor Essex Community Health Center. So thank you so much for joining us tonight, Claire, and we look forward to your presentation and ways in which people can look for some help and support and reducing stigma and all that good stuff.
So my name is Claire. I'm an addiction support worker, part of the STEPS team that's based in the Windsor Essex Community Health Center. So STEPS stands for Stability Through Education, Prevention, and Support. So I'm going to try to not overlap with some of the things that were already spoken about today. So I'll do my best. So as we were hearing, what is an addiction? Addiction can be defined as a state of physical or psychological dependence on a drug or activity. So already we heard a number of really powerful personal stories this evening. And so the substances are really wide-ranging activities. So certainly tonight the focus is on drugs and fentanyl specifically, but there could be other things like alcohol, gambling, gaming, food, shopping. And so the harms of substances can really range as well. So from mild, so to feeling hungover, being late to work, to severe, so could be a result of disease, homelessness. And so these harms really vary depending on the substances and the behavior that's considered harmful. And so stigma and addiction, I mean, I think that everyone's quite aware that there's a lot of shame often associated with addiction, which really further isolates folks that are using. So I think it's important that we have community events like this that really brings it to the open and to accept folks and to really understand where they're at and what they go through. So addiction doesn't occur in isolation. Often it's there's trauma and deep-rooted issues. And so using is a way of coping, self-medicating with overwhelming feelings, thoughts, flashbacks sometimes. And often people could be using more than one substance, and the focus is to look at the one that's at the highest risk where possible. So one of the tools that we use to determine if someone's use is problematic are the 4 C's. So the first one is craving. I think everyone can relate to this. It's an urge that drives us to consume things. The second one is control. So as we often see a loss of control in the amount of drug used, or how often the drug is used, especially in social situations when peer pressure is involved. And compulsion, so there's a desire or intense need to use the drug. An example could be people who smoke cigarettes and want to quit and don't enjoy smoking, but are driven to smoke nonetheless. And finally are consequences. So when someone continues to use despite experiencing negative consequences like school suspensions, family conflict, peer issues, financial health issues. So some of the warning signs, so a lot of these that were mentioned before, I'd I guess ones that I'm not sure if if I missed they were mentioned, but so certainly falling behind in school, missing work, cash, valuables, or medication is missing from the home, or if people are using like cash advances or payday loans, or if their friend group changed suddenly, or could be if it seems like someone's being deceptive or secretive, or leaving the house for short periods of time, if others are visiting for short periods of time as well, sleeping excessively at atypical times of the day, or noticeable increases in snoring, constipation, sudden mood changes. So some of the risks are, I guess the potential consequences really are 1 in 10 will become addicted. Accidental overdose can lead to death. Psychosis, as well as mental illness, can present itself and or be amplified. And it also can impact the brain structure as well. So just to backtrack, so psychosis is used to describe conditions that affect the mind, in which people have trouble distinguishing what's real and what's not. And when this occurs, it's called a psychotic episode. A first episode of psychosis is often really frightening, it's confusing and distressing, particularly because it is an unfamiliar experience. So other risks are mixing. So when folks mix drugs together, so especially opioids and benzos or alcohol. So if someone is using, then it's safer to use one drug at a time. In terms of tolerance, so that can change if someone hasn't used in a while. So if they've been hospitalized or in custody at jail or in treatment. Or with illness, stress, or weight size. These are all things that can impact someone's tolerance. Another risk factor is if someone uses alone. So often when I'm meeting with folks, I'm asking them, when you use, are you around anyone else? Because if they're not, then that really puts someone really at risk, because no one would be there to help them. So it's important that if someone's using, that there's someone else around, that they're with a friend, but to not share, and to leave the door unlocked, and to call someone to let them know that they are about to use. And there's actually, recently we heard about a phone line that folks can call into if they are about to use, and a person will stay on the line with them. And I can get that number to you, Alex and Jody, just so we have that if people are interested. And in terms of back to risks, so drug quality and potency. So you can't tell how strong an illegal drug is going to be. It may be different each time someone uses them. So it's important that like a small amount is tried at first. So our STEPS program is an addiction harm support program. So we provide free and confidential consultations for individuals. So it's through one-to-one support, and also for family members who have a loved one that does have problematic use. And so it could be, if someone's looking to make changes in their use, looking to support someone with their substance use challenge, looking for harm reduction supplies and or naloxone kits, or maintaining and creating recovery goals, and also advice around addiction treatment. So our program there's no time limit. It's client-centered, so we do our best to meet the individualized needs of each person. And also we do outreach, and we are mobile. Mainly at this point, because of the pandemic, a lot of our appointments are over the phone, but we do have the ability to see people in person as well. And we also do outreach that's partnered with our Hep C team as well. And I'll get into that in one of the next slides. We provide advocacy to folks as well. And we do hold support groups as well. So actually our next group is called Steps Forward. So that's a 5-week session that will be starting on Monday, December 14th. So if people are interested, they can contact the Sandwich site and they can connect you from there. And so we are partnered with Positive Pathways, so it's an important community partner to us, to provide sterile supplies to individuals who don't have access to them. So we also provide the naloxone kit training, which I will touch on in this presentation as well. And so our outreach services are really important, especially given that there's a lot of stigma with addiction and people may not feel comfortable accessing services or going to certain places. So we're able to work towards eliminating those barriers wherever we can. So I've been mentioning harm reduction a few times, so I think it's important to just really understand what that is. So this is an approach that's used for individuals who may not be ready, willing, or able to give up all substances. And this approach recognizes that some people are not ready to change their use, may not have a goal of abstinence, and may be willing to stop using one substance, but not another. Also be open to learning how to decrease the harms of their substance use as well, and also may be likely to seek treatment if it doesn't require abstinence as well. So it's also helping people learn safer ways and to really reduce the risk. So with the providing sterile supplies, that's really important in terms of reducing any transmission of infections. And also it's a way of really engaging with folks and building that relationship and helping to ensure that their basic needs are met. So whether that be food, shelter, medical care, and also connecting folks to substituting a safer drug for the one that is being used. So substituting using methadone instead of heroin. So I do have some slides on fentanyl, but I recognize that Misty had a thorough presentation on this. So I'm going to skip over some of that because I think she went into good detail about that. So naloxone. So naloxone is a medication that can reverse the effects of an opioid overdose. You may also hear the word Narcan, and so Narcan is the brand name that people are often the most familiar with. So naloxone temporarily blocks the effects of opioids by binding to the same receptors in the brain that opioids do. And it's important to remember that naloxone only works for opioids. So who will overdose? There's no exact way to determine the amount or combination that will cause overdose. Weight, tolerance at a particular time, opioid drug strength, the route of use. So if someone's injecting, snorting, inhaling, swallowing. There's also increased risk of overdose within the first 2 weeks of release from jail or hospitalization. So in terms of us as the addiction support workers, we do meet folks in detention in custody at the Southwest Detention Center. And also we have a worker who's based in Windsor Regional Hospital at the OLEC campus as well. And our other worker who works in the county who does the outreach in that area. So how to recognize an opioid overdose. Again, this was touched on as well, but just to review. So breathing is slow, fingernails and lips are turned blue or purple, body is limp, deep snoring or gurgling sounds, vomiting, loss of consciousness, or unresponsive to stimuli and pinpoint pupils. So the 5 ways to respond to an opioid overdose. So one, sorry. So stimulate with noise. So shout their name, ask, hey, are you okay? Stimulate with touch. Always tell the person first that you're going to touch them. Shake their shoulders, rub their knuckles hard on their chest bone or under their nose, pinch their earlobe. If the person responds to stimuli, keep an eye on them. Don't leave them alone in case the drugs they have used may not have fully taken effect and they could still overdose. So if the person doesn't respond to step 1, then you would proceed to step 2, which is dialing 911. So if you're calling 911, then if the person is unconscious, stay with them, obviously. So some dispatchers will ask if you need an ambulance, fire, or police. So tell a dispatcher someone is unconscious and not responding. And then you would administer the nasal naloxone. So you'd lay the person on their back, wipe the nose clear if necessary, and keep the head tilted backwards slightly with one hand. And I will say too that this is training that we're able to provide as well, but I just wanted to give you a brief overview as well. So there would be the package within. So you would peel back the package to remove the device, hold the device with your thumb on the bottom of the plunger and the 2 fingers on the nozzle. Second step is you would place and hold the tip of the nozzle in either nostril until your fingers touch the bottom of the patient's nose. And you'd press the plunger firmly to release the dose into the patient's nose. The step 4 would be, depending on whether or not the person is breathing and your training and comfort level, you'd put the person in the recovery position or perform the rescue breathing and or chest compressions. And step 5, if the person has not started breathing on their own with 2 to 3 minutes, you'd give a second dose of naloxone in the other nostril. And you'd continue the chest compressions and rescue breathing until ambulance arrives or the person starts breathing on their own. So this is the recovery position, so on their side. Head tilted back slightly to open the airway, hand supports the head, and the knee stops the body from rolling onto the stomach. So when the naloxone starts working, it will cause mild to severe withdrawal symptoms. So agitation, anxiety, muscle aches, sweating, nausea, vomiting. So after using naloxone, it's really important to debrief. It can be really traumatic. And so it's important that you talk to someone about it, about what happened with a trusted family member, friend, counselor, or health professional. And you can contact us as well. Okay. And so this is a really important piece. It's the Good Samaritan Drug Overdose Act. So this is an act that protects you from being charged or convicted for drug possession if you call 911 to report an overdose, or if you are at the scene when emergency services arrive. And it's true even if you're on probation for possession. So I wanted to just mention a few strategies since this session is particularly geared for families with a loved one. So I think, learning about substance use is super important. It's what you're doing now if you're tuning into this. So understanding, what is an addiction? How does it impact a person? Learn why your loved one may use as they do. Communication. So how do you communicate in stressed interactions? Are you able to step away from fighting, arguing, and try new skills in communicating that like diffuse and open up conversations? Use kindness, which I always think is not as easy as sometimes people may think. It can be complicated, but I think using kindness and collaboration as opposed to confrontation or conflict is really important. And staying connected. And so I think Margaret mentioned this earlier as well, was staying connected with her son. So that family involvement is key for improvement and helps maintain positive change. Detaching or cutting a person out of your life will drive the person away. So really staying connected and provide encouragement. So acknowledge the positive steps, however small, the actions, and provide good options, so not ultimatums to your loved one, and healthy boundaries. So figuring out, okay, how can I help them? That's not enabling, right? And that's no easy task, but it's important to really focus on. And also self-preservation. So don't leave yourself out. So helping yourself is helping your loved one, really. So your own well-being is crucial. Really focusing on like your own internal resources are going to run low and you can feel depleted, certainly right now and being in a pandemic. So your emotional and mental resiliency, your physical health, social supports, and perspective on change is foundational to your own well-being and also to your capacity to contribute positive change for your loved one. So in terms of folks, how we often are connected with folks, it's often with self-referrals or through community agencies, or sometimes even family members will contact us on behalf of their loved one, or maybe the family member themselves is looking for some support as well. And so if anyone is interested in accessing the STEPS program, we do have our online referral form, but also people can call in and into our sites and go from there as well. So just to recap, we have 3 addiction support workers that work throughout the Windsor, Essex area. And if you have any questions, you can contact us at these numbers below. Thank you.
Thanks so much, Claire. We really appreciate you sharing your expertise with us. And STEPS is certainly a program that we're really proud to offer at WCHC. So I just want to take a quick moment to share my screen here and to show you some supports and services that we do have across Windsor, Essex as well. And I'm just going to bring that up now. Hold on, Claire, I'm sending you back to the attendees. Okay, there we go. So if I share my screen with you, you can see this comprehensive list that we're going to share via email, and please feel free to circulate this far and wide. So we do understand that, you know, it's not a one size fits most solution, right? There's a variety of supports and services in the community, and you know, we're pleased to share this with you. It's not about us necessarily receiving every single referral call. We know that folks need to access services that are best suited for them. And if we can get you that information, then we're doing our job. So like I said at the beginning, this initiative, you know, began in 2017, and it continues today because of the strong community engagement that we have, and we're very fortunate to have. And we do want to take a moment to thank each and every one of you for spending your night with us. And this isn't necessarily an easy topic, so this is something that's, you know, heavy in our hearts, and we really urge you to take some time for yourself tonight. Check in on your loved ones and certainly check in on yourself. And please remember, if you have questions about our addiction support worker program or any of our other services, visit www.wechc.org and you can call a location nearest you to get more information on those services. Please also be sure to follow us on social media. And one more time, we just want to thank you again, and we're going to wish you all a great night and stay safe and stay well during this pandemic. I do see that there are some Q&A, so we'll take a moment to make sure that those are answered as well.